everyone. I would like to welcome everyone to today's webinar, Child Poverty and the CARES Act. I am Cara Baldari, Vice President of Family Economics at First Focus on Children, a bipartisan national children's advocacy group dedicated to making children and families the priority in federal budget and policy decisions. First Focus is the founding member of the U.S. Child Poverty Action Group, a partnership of over 20 national organizations working to address child poverty in the United States. In February 2019, the Child Poverty Action Group launched the End Child Poverty US campaign with the goal to establish a national commitment to cut the US child poverty rate in half within a decade. More information can be found at our website, endchildpovertyus.org, where you can make sure to join our listserv. And so we are honored to be joined today by Congressman Jimmy Gomez, who represents the 34th District of California. He is a member of both the House Ways and Means Committee and the House Committee on Oversight and Reform. Most importantly, he is a 2019 First Focus Champion for Children due to his leadership on issues such as family tax credits, affordable childcare, paid family medical leave, and more. So with that, I'm going to turn it over to Congressman Gomez to make a few remarks.
First, thank you so much for inviting me, and today's webinar is such an important topic. And before I turn it over to the experts, I want to just make a few remarks about what we are talking about here. As everyone knows, especially the folks on this line, child poverty is both a moral failure and a policy failure. Unfortunately, we have long had a child poverty crisis in this country. For these children, the long-term repercussions of living in poverty will echo for the rest of their lives. We know that children from poor households do worse than other children on many other outcomes, including health, development, and education. And these challenges can persist later in life in terms of social mobility. Children of color were more likely to live in poverty before this pandemic, and those disparities are worse today. The COVID-19 crisis has only exacerbated this inequality. The moral imperative is clear, but so is the policy imperative. Because I mentioned before, child poverty is a policy problem, but it is a solvable one. So let's go back to before the pandemic. We know that existing federal programs like SNAP and SSI, as well as the Earned Income Tax Credit and the Child Tax Credit, do work to reduce child poverty. Before the pandemic, nearly 8 million more children would have lived in poverty without these key programs. But too many barriers existed and still exist for families to access them, and they still don't reach enough families. So let's fast forward to the COVID-19 pandemic. Unemployment has increased dramatically, and even with marginal improvements, there are still tens of millions more Americans unemployed than at the beginning of the year. Those dynamics are felt across the board, but not evenly. Women and people of color have higher unemployment rates in addition to having higher cases of COVID in their communities. The CARES Act was a flawed but hugely significant piece of legislation, the largest economic relief/stimulus package in American history. As our experts on this webinar will discuss, it played a major role in keeping millions of Americans out of poverty. The CARES Act included a number of provisions intended to keep employees tied to their jobs, from relief to industry to the employee retention tax credit. But we also succeeded in fighting for direct aid to individuals. These key provisions include one-time direct payments, usually $1,200, as well as significant expansion of unemployment insurance. While the one-time payments were important, they were not well targeted and quite clearly not enough to tide people over during this multi-month crisis. Too many people also had trouble assessing these payments, especially the $500 payments for children. The expansion of unemployment insurance was hugely significant. We increased payments by $600 per week to roughly equate to the wages of average American worker. We added an additional 13 weeks of payments that are usually capped at 26 weeks. And for the first time, we made assistance available to self-employed and gig workers. And if we look at the $600 per week, for example, here in California, you take the $600 and add it to the max unemployment payment that an individual can get, it comes out to about $1,050 per week. And if you multiply that over a period of time, it really comes out to replacing the net take-home pay, 100% of the net take-home pay for anybody who's making $76,300 less or less a year. So it is a significant bump, but it ends too soon. It ends at the end of this month too soon. We got to make sure that we extend those benefits till the end of the year at least. So we have to really get this focus on this issue, get the money out the door, beef up these programs, and make sure that we do not pull back too soon, as in some cases we're opening up our economy too soon, and you're seeing the spikes in the coronavirus pandemic. So the fact that the CARES Act has been a big part in the prevention of exacerbating poverty because of COVID, we still have a lot to do. One of the things I want to be very clear of, I think that this issue is not just about specific communities. It's not just about people who are most impacted. It's about the health of our democracy as a whole. We know that the facts. One, here in California, half of the children born in 2002, little known fact, were of Latino descent for the first time in the history of this country, and that of the state. And that percentage of those children born of Latino descent was only increasing. But fast forward to 2020, a lot of those children are now graduating from high school, trying to enter college, trying to succeed. But we know the facts between Latinos and African Americans, and the fact that, one, they're likely to do worse on a number of indicators, as we mentioned at the beginning: health, economic, mobility. Keep going, and you see those indicators, just the disparity between Latinos and African Americans and whites just be tremendous. But the health of these communities is crucial, because the health of our democracy itself depends on it. And if you have a disparity that exists between the majority and the minority population, it only is something that has been tolerated when those populations are a smaller and smaller percentage of the population. But once they become the majority of the population, you have a significant threat to the democracy itself if we do not acknowledge that their outcomes are going to have a big determining factor on our country as a whole. So child poverty and the CARES Act, huge issue, but it should open our eyes to the fact that if we care about our country as a whole, that we should target child poverty in the Latino, African American, and the communities that have been left behind by our systems for far too long. So I want to say thank you for all of you who are on this call, because I know that you guys get that. I know that you have been fighting the good fight for a long time, but I hope that some of the lessons from the pandemic, from the protest in regards to the death of George Floyd and the systematic biases that are built into some of our policies themselves, that it will be the beginning of the restructuring of some of those policies, systems, and institutions to diminish that disparity between the Latino, African American, and the minority populations with the rest of the country. So with that, Cara, I'm going to hand it back to you. I greatly appreciate your inviting me, and sorry my video wasn't working. I haven't figured it out. It's a new system. So thank you so much.
Thank you so much, Congressman, for those remarks and that really helpful framing for our discussion. And just thanks so much for your leadership on behalf of children and families, and look forward to continue to watch and support your work on the House Ways and Means Committee. And thank you so much.
Of course, thank you.
So I really want to emphasize what the Congressman said, in that, even before the outbreak of COVID-19, child poverty was a moral crisis in the United States that affected each and every one of us. The pandemic and resulting economic recession have served to only expose and exacerbate existing inequities in our society, and that these continue to disproportionately impact families and children of color. Unemployment has reached a level not seen since the Great Depression, causing low-income household budgets to be stretched even thinner. And new research from Columbia University Center on Poverty and Social Policy, which we're going to hear more about soon, finds that aid passed by Congress in the Coronavirus Aid, Relief, and Economic Security, or CARES Act, specifically expansion to unemployment benefits and the establishment of one-time recovery rebate payments, may have prevented child poverty from spiking. Yet these findings also recognize that many children and families continue to face significant hardship as they wait to access assistance or find themselves ineligible for benefits, as is the case for millions of children and immigrant families. According to the most recent Census Household Pulse Survey, the economic crisis continues to hit families with children the hardest, with 1.3 million children living in a household that is still struggling to cover the costs of both food and housing due to the pandemic. So given recent spikes in caseloads and an economic crisis that continues to deepen, it is critical that Congress pass additional emergency relief that includes longer-term structural investments to both mitigate the impact of our current crisis, as well as address our nation's consistently high level of child poverty. The HEROES Act that was passed by the House in May has some really helpful provisions, and we are hoping that we could see many of these enacted into law and even provisions that may go further. So a few logistics before we get started. All attendees are muted throughout today's webinar. This webinar is being recorded and will be sent out to everyone who RSVP'd. It will also be available on our website and childpovertyus.org under the webinars tab in the next few days. And we'll be taking questions at the end, which can be submitted in the Q&A box on the right-hand side. And please specify if you would like to direct your question to a particular panelist. And so now we're going to hear from our panelists. We have Zachary Parolin and Megan Curran, who are both postdoctoral research scientists at Columbia University Center on Poverty and Social Policy. We have Cathy Battle, who is the executive director of the Western Pennsylvania Diaper Bank. And we have Indi Dutta-Gupta, who is the co-executive director at the Georgetown Center on Poverty and Inequality. And again, a reminder that we're taking questions at the end. So for now, I'm going to turn it over to Zach and Megan.
Thanks, Cara. I appreciate it. Just loading up my video here so I can say hello to everyone. Great. Yeah, thanks again, Cara. Yeah, thanks to First Focus and to Congressman Gomez as well for what was really a perfect introduction to the challenges that we are facing as a country right now and the challenges that we're going to talk about on this webinar. I also want to say thanks to all of you tuning in from across the country. As I said last time we spoke with First Focus, it's not often enough that we as researchers get to engage with the advocacy teams out there, all you working organizations across the country to try to make life better for families with children. So thank you for your work, particularly in this moment that we're in right now. I think it's more important than ever that you continue doing what you're doing. So I'm going to do a couple things. I'm going to start with a brief overview of what we've been doing at the Center on Poverty and Social Policy at Columbia with respect to simulating poverty rates and the CARES Act's effect on poverty rates in the US. I'll start with a broad overview and then I'll get into 4 specific points that I'd like to make. So the broad overview is this. In April, just after the CARES Act was passed and as we started to see unemployment rates spike to quite high levels, our team at Columbia tried to put together a first round of estimates of how high poverty rates might climb if unemployment reaches certain levels. And so what we found is that if unemployment reaches, say, 20% or climbs even higher than 20%, we could be looking at poverty rates in this country that we have not seen since at least 1967. Now, this was before taking the CARES Act into account. And in a brief we released last week, about a week and a half ago actually, we brought the CARES Act into the picture to try to understand how these expanded unemployment benefits and how these stimulus checks are likely to affect poverty rates in this country in 2020. So in talking about those results, I just want to emphasize first, we labeled our brief the promises and pitfalls of the CARES Act. And it's important to keep both of those in mind. I'm going to talk about some of the promises first, but then I'll say a couple things on pitfalls and I'll turn it over to my colleague Megan, who's worked hand in hand on this analysis to talk more about who's left out of the CARES Act and the shortcomings of the CARES Act. But first, the 4 points that I want to make. Number one is answering this question. Why is it important to do the type of analysis that we're doing? Why is it important to try to simulate poverty rates in the present crisis? The first answer to this is that these official estimates of poverty rates for the US that we have right now are from the year 2018. And we won't see official poverty rates for the year 2020 from the Census Bureau until sometime next autumn, about a year and several months from now. So this is why our team, as well as other universities across the country, Chicago, the Urban Institute has a new report. This is why we've been trying to simulate poverty rates for the present moment to get some understanding of the pain and hardship and situation that families are experiencing throughout the country and the role of these transfer programs in reducing some of that pain, reducing some of that hardship. I'm going to be presenting some numbers from our report that use the Supplemental Poverty Measure, or the SPM. And I imagine most of you on the call are familiar with the SPM, but if not, here's a couple things you need to know about it. Unlike the official poverty measure, the SPM takes into account geographic differences in living costs. It incorporates all taxes and transfers, such as SNAP, the EITC, and so forth. And as of our report last week, we bring the CARES Act's income transfers into this SPM resources definition to try to understand what poverty rates look like today. So the second point I want to make is this. Before we get into the numbers on poverty rates, it's important to understand just how large the CARES Act is. So as you all know, the CARES Act was introduced in March as a response to rising unemployment rates. And the two major components with respect to incomes and poverty reduction are the expanded unemployment benefits, so the pandemic unemployment assistance, which expanded unemployment to, say, gig workers, part-time workers, individuals who might not ordinarily qualify for UI benefits. The PUC, or the pandemic unemployment compensation, that's that $600 a week bonus on top of standard unemployment benefits. And the PEUC, which extends the duration of unemployment. So that's the first major component. And the second are the stimulus checks. In combined, the Congressional Budget Office projects that the unemployment benefits and the stimulus checks will introduce about $500 billion worth of income transfers to the general public this year. And to put that number into context, $500 billion, that is more than we spent in 2019 on all direct income transfers to the working age population combined. So you could take SNAP and the EITC, put them together and double it. The CARES Act is still more than that value. It's a large transfer, and it's exactly what we should expect given the magnitude of the crisis that we're in. The third point, so given that the CARES Act is large, $500 billion, we can expect that it has some type of poverty reduction effect. And sure enough, that's what we found in the report that we released just last week. I'll say one thing about some of the assumptions we had to make before getting into the numbers. So as you all likely know, there have been large challenges with respect to access to the CARES Act benefits, particularly early on in April and May. Many families who were eligible for these unemployment benefits were just not receiving them. So we decided to project 3 different scenarios of poverty depending on how high access to these expanded unemployment benefits and recovery rates might be. And I'm going to talk mostly about what we call our medium access scenario. And in that scenario, we assume that 70% of families eligible for the recovery rebates or the stimulus check will receive that stimulus check, and about 60% of the recent jobless will receive those expanded unemployment benefits, whether it's the PUA or regular unemployment insurance. So that's our baseline assumption. And if we're willing to make that assumption, we take our April data where we saw unemployment rates almost 20% after addressing misclassification mistakes. And our key takeaways are this, that Before the crisis, the poverty rate we project was around 12.5%, again, using the SPM that I mentioned before. In April, but before bringing the CARES Act into account, the poverty rates climbed to about 16.3%, we project. But when we bring the CARES Act into the mix, poverty rates come back down to basically where they were before, 12.5% or around 12.7% for the full population. For children, it's largely similar, 13.3% at baseline, climbing to 18% before the CARES Act is taken into account. And then after bringing in those stimulus checks and unemployment benefits, we're projecting child poverty rates around 13.7%, which is, again, pretty close to what it was before the crisis using the SPM. So the CARES Act has potential to make large gains, large reductions in poverty rates compared to what we would have seen otherwise, assuming, again, that access is adequate. I do want to emphasize that, we talk about the CARES Act getting us back to baseline, but baseline was not all that adequate to begin with. We're still seeing Black children in particular facing twice the rate of poverty as white children, Latino and Asian children facing elevated poverty risk compared to white children. There are still massive racial disparities. There's still age disparities. But I suppose the good news is with the CARES Act, we don't project they're getting much worse. But again, at baseline, they weren't that great to begin with. So we're sort of back to where we were. And we'll talk again, and Megan will talk more about what happens if these benefits expire at the end of this month, what poverty rates could look like, second half of the year. I want to emphasize that, we are not alone in coming to these conclusions. Team from the University of Chicago found similar conclusions using different methods. And just yesterday, the Urban Institute released a report that finds, again, similar conclusions, that the CARES Act has potential to offset the increase in poverty that we might otherwise see. So the fourth and final point I want to make is this. Many of you might have seen results that suggest levels of food insecurity are high and rising. And these results come from multiple different data sources. They are real and to be taken seriously. And if you do take them seriously, you might wonder, why do we see these three studies projecting somewhat stable poverty rates, but these other three surveys projecting high and rising levels of food insecurity? What's going on? So I want to say one brief word about this, just to emphasize that both of these indicators are important, but they are different and carry different meaning, and we need to take them both seriously. We are projecting annual poverty rates based on annual income. And in doing so, in these calculations, it often doesn't make a difference, to our numbers. If a family gets expanded unemployment benefits in, say, August versus May. But in reality, it of course matters for families that the delivery is on time and that it's consistent. If you don't receive those benefits in May and you run short of money, it's no surprise that levels of food insecurity are going to be higher than if you have to wait several months to get those benefits. So it's important to keep this component of income volatility into mind. And it's important to keep in mind that even if we see stable poverty rates like we are projecting and others are projecting, this doesn't mean that everything is fine. There's a lot more work to do, particularly with ensuring smoother administration of our income supports. Some other factors that might be driving these disparities, even in normal times, most families experiencing food insecurity are actually not in poverty. Only about 30% are below the poverty line. We can discuss more later on what that says about how we measure poverty and so forth. It's worth keeping that in mind. We know that food prices are rising. We know that children are not getting lunch from school as they might have in the past in many cases. And again, many families who would be supporting other families, making sure that their neighbors are able to put food on the table, it's a bit tougher to do when these families are also struggling. So it's entirely possible that both high levels of food insecurity and relatively stable poverty rates exist. And it's important to keep both of these indicators in mind. They tell us something a little bit different. Just to emphasize one more time, just because we see stable poverty rates does not mean that everything is okay. And I'm going to turn it over to my colleague, Megan, who's worked on this analysis as well. And she's going to elaborate a little bit more on some of the shortcomings of the CARES Act and what happens after this month those benefits are not extended.
Thanks, Zach. Hi, everyone. My name is Megan Curran. I'm also at the Columbia University Center on Poverty and Social Policy. And I worked with Zach and also our colleague Chris Weimer on some of the recent analysis that we've been putting out, and also with some supplemental pieces that look at who is not receiving these benefits and what's happening to those populations, all of which is quite relevant, obviously, for forthcoming, policy discussions in terms of what should be extended, but also how it can perhaps try and capture some of the folks who were left out of the initial round of payments and things like that. So here I'll just touch on a few more additional bits of the broader context our findings sit in. I'll talk about why it's important to pay attention to who's left out, and then what this might mean for the local and federal context that Cathy and Indi will be able to speak to in the second half of this conversation. So I think, as Zach was pointing out, the hardship measures that we've also been seeing released by really important work coming out of Brookings and elsewhere, talking about especially for families with young children in the household, that food insecurity and hunger is rising and is significantly above where we would have seen in non-crisis years last year and the year before. And I think that really points out why a range of indicators are useful always, but now more than ever, because the situation is changing month by month, and sometimes some of the measures that take into account what's happening on the household level on a more regular basis can be really informative in terms of understanding the experience of families versus what might their household budget or bank account look at the end of the year when you take all the months in total sum. When you think about the approach that other countries take to measuring poverty, a lot of times they use multiple measures. They of course look at whether or not people are below or above a certain income threshold, but many countries also, especially for children, try and capture some element of deprivation. This is usually questions that are inserted in their regular sort of income surveys that inform their income poverty measurements, but they also try and ask, are kids able to receive the meals that they would normally be eating? Do they have adequate clothing? Do they have adequate heat? Are they able to participate in their normal activities and things like that? And while the deprivation numbers are not necessarily used for program eligibility or things like that, other countries have some models that are useful in terms of thinking about how we can still collect that deprivation information alongside the income poverty piece. And I think that, even though that's not necessarily the official measure that we use here, it's important to take both the income pieces and the hardship pieces together, because they're kind of telling complementary sides of a family's story. So in terms of what Zach was talking about in terms of the policy response, we're talking about, again, whether or not a family is potentially going to end up above or below the income threshold for the entire year. We're talking about the supplemental poverty measure, that captures a bit more than the official poverty measure, of course, but it's by no means assuming a generous, threshold for living. It does vary very much by where you're living in the country and how expensive housing is where you live, city versus rural area, one state versus another. But, you could think about roughly an average for a family of four being, still only about $28,000 for the year. So just because, families are able to be kept technically above that level, obviously by no means does that mean that they're well off or comfortable or that they're not experiencing, financial stress for any number of reasons. we know that, you know, for children, in terms of the safety net, eligibility in general, that does work, you know, really hard in normal times to keep millions of kids above the poverty line. You know, the tax credits do so much. SNAP does another extra layer for families in particular. It has, you know, some significant drawbacks, especially in responding to crises that we have right now. One in particular is that a lot of the regular assistance that families are able to access, sometimes it varies by state, but it's also for kids, it's very much dependent on, you know, their parents' employment status. It's tied to whether or not they're in work in general. It's tied to their level of earnings then in particular. So for families with kids in normal times, you know, if there's an interruption to your work or an interruption to your earnings with its, you know, it could be changing a job, losing a job, the birth of a child into the family, some sort of health or caring concern. You know, you know, it depends very much on where you live and the circumstances that, you know, that change in income happened, whether or not you're able to access enough to kind of keep going. All of these things are very much brought to a head, obviously, in the type of, you know, both public health and economic crisis that we're facing right now. And so I think some of the important pieces of the CARES Act that, you know, it's almost could be surprising when you think about how much hardship is out there and the scale of the economic sort of shocks that we're experiencing, that annual poverty rates could potentially be blunted in terms of their rise, is that some of the most crucial, you know, direct aid, as the Congressman mentioned, to households functions in a way that is not necessarily always the case. The expanded unemployment benefits are, you know, providing levels of nationally uniform top-up payments that try and, you know, function as more truer wage replacements that the previous system didn't necessarily provide for everyone. It's capturing people who were not necessarily covered before. You know, part-time workers, self-employed workers, gig workers, independent contractors, you know, people who might have fallen through the gaps before are now receiving coverage, and that's really important. And in terms of the cash payments, you know, there's basically the income threshold, but there were no sort of extra requirements that you had to meet for those of the families that were already in the tax system in recent years. Many people received it without, you know, too much difficulty. But all of that being said, some of the sort of supplemental analysis that we've been looking at is to try and pay attention to the fact that too many people were still left out altogether, and then too many people are unfortunately still, you know, having to struggle to receive things that they are eligible for. So just to touch on who was left out in general, ourselves at the Center on Poverty and Social Policy and a number of other organizations now, including the Center on Budget, Migration Policy Institute, and others have been trying to look at some of the folks who were not eligible to receive the cash payments the way that the CARES Act was written. So many of you are probably aware of the age cap that was placed on dependents who could receive payments. So if you're age 17 and older and you're still claimed as a dependent by your family for tax purposes, you were not eligible to receive a payment in your own right, and your family didn't receive it for you. So estimates from some papers that we've done, and again, the Center on Budget and Migration Policy Institute, we're seeing about 15 million individuals age 17 and over who are missing out on the CARES Act cash stimulus payments, merely just due to that age cap on the dependent exemption. So that's 10 million 17 to 24-year-olds. Most of these are high school and college students. Their learning has been severely disrupted. It looks like their fall semesters are also likely to be severely disrupted. And the majority of them are not necessarily in employment in general because they're studying or, so it doesn't necessarily mean that they're automatically maybe receiving unemployment insurance benefits. They're kind of falling into a gap here. Another 5 million older adults. So these would be, folks with significant health issues who don't live on their own, or very elderly, low-income individuals are not receiving them either. The Migration Policy Institute identified another 15 million individuals who were left out, and this is due specifically to the immigration status restrictions. So if you file with an ITIN, an individual taxpayer identification number, rather than a social security numbers, it wasn't just you that was knocked out of eligibility for the payment, it was your entire family. And so that it also includes US citizen spouses or kids, or those who are here with a green card. So taken all together, that's already 30 million folks who would have been, income eligible, but are excluded from the payments. These numbers are going to pop up, in hardship numbers, certainly, because all of these folks are not necessarily receiving things. And so, even if they're technically above the poverty line, they're going to, potentially be having trouble paying their bills or covering other unexpected expenses now that have popped up. In terms of unemployment insurance expansions, undocumented individuals are left out of those as well. But we've also seen, just again, disparities in access across the country. The sort of expansion in coverage that I talked about, that's been the slowest sort of take up by states to report in terms of payments. And so some of those who would have been on some of the very lowest incomes and not traditionally covered by unemployment benefits, they might still be receiving, that in the sort of most uneven way. And so that again is going to play into the hardship pieces and is something to keep in mind as we think about who might lose out, from the expiration that is looming. We also saw that, some of the biggest differences in poverty from the CARES Act expansion, happened for, children in Black families and Latino families, and also, the adult workers in those families as well. And so the loss of the $600 a week top-up payments is, going to sort of play into exacerbating these underlying disparities. And we also know that, for folks who just didn't receive the unemployment benefits in general, even if they might have been eligible for them, our analysis shows that the poverty rates for people who didn't receive the CARES Act unemployment is about 5 times higher than the poverty rate for people who did receive the CARES Act unemployment benefits. So the impact of the sort of significant levels of investment here in these programs is key. And it also means that there is, quite a lot to be lost for families if things are allowed to expire. I'm going to pass it off just in a moment now to Cathy and Indi, who can speak to, some of the more localized context of what's happening on the ground with family need, and then in terms of the federal policy context, because we know that conversation is looming. Cara mentioned that the HEROES Act would rectify some of that the HEROES Act that was passed a little while ago by the House, in terms of linking up to what I've been talking about and who's left out, the HEROES Act would rectify some of this. They would try and capture those dependents who were left out of the CARES Act payments and retroactively extend that payment to them. They would also try and address the immigration exclusions and include those who file with ITINs for receiving the payments as well. They include another round of cash stimulus payments, this time with parity in the amount level for adults and children. So it would be a maximum of $1,200 each rather than the $1,200 and $500 that we have currently. And it would extend again temporarily some of the key unemployment provisions. So it's important to keep in mind, that there is an opportunity that people have been looking at it, but we also kind of have the numbers to back up, why this investment has been so significant to date. And also, the fact that things could be worse if we don't have continued investment, both in terms of what we're seeing from the hardship numbers complementing this, and also the fact that, as Zach mentioned, our analysis is underpinned by unemployment rates as they were recently. But if unemployment, spikes again, say later this year, and there is no second version of the CARES Act or expanded things here, then essentially our numbers won't necessarily hold, and poverty could potentially increase. So there's, it's a lot of moving parts, but I think it's important to just realize how much, can be done with significant levels of public investment, but also that we still need to pay attention to those who haven't been able to benefit from it yet, and those who might lose out most, if we don't think about ways in which we can continue some forms of regular support. So with that, I think I'll pass it over to Cathy, and she can speak a little bit more about what's happening closer to the ground.
Hello, everyone. First of all, I'd like to thank you for the opportunity to participate in this webinar. Thank you to Congressman Gomez and First Focus. I am the Executive Director of Western Pennsylvania Diaper Bank here in Pittsburgh, Pennsylvania. And so I just want to say a little bit, like when this COVID-19 first hit and we shut down the mid-March, but the diaper bank, we stopped for about a week, but then we decided we're going to continue to repackage diapers because we anticipated families needing diapers, because we already knew that 1 in 3 were struggling before COVID to diaper their babies. So we continue to repackage diapers, get our warehouse ready. By the time April hit, our partner agencies were calling because the clients were calling them that they were in need of diapers. And so what they did was they were making appointments with them one-on-one. They were putting diapers in the back of their car because of COVID-19, but we were still trying to get the diapers out to families. But through it all, even with my partners, they were doing what they needed to do, but we still were receiving many phone calls and many emails about families in need of diapers. And additionally to what we were doing. And so those calls were coming from the urban community, which we expected that because of temporary unemployment. They needed that diaper money to buy food or just to pay a bill to stay in their house or keep their lights and stuff on. But we also received calls from the suburbs because they were unemployed. The businesses were shut down. People were in need, and also the rural area. But when you look at the suburbs and the urban community and the rural area, what we found out is they all had a transportation problem. And then at that time, buses were only allowing maybe 10 people on at a time. The suburbs, the buses only went to a certain area and maybe they had to have a car to get to the bus stop. And the rural area, we know they just have a transportation problem and all. And so during this time, there was the diaper shortage. And, they were all on TV talking about, the diaper need, the diaper shortage. And we knew it was there, and the other nonprofits were getting calls about diapers. And so they reached out to me and said, are families calling you about diapers? Because we're getting calls about diaper need, and we don't even do diapers. So at this time, we partnered up with other nonprofits to get diapers out in the community. So there was grants being offered for COVID-19 through foundations. And so we partnered up with them and we got the grants, and we're going to get more diapers out in the community, which we did. We did diapers, we did wipes, we did formulas because this is what the families were asking for. Because none of this was on the store shelves, and they lost their jobs. So we did that, and also the foundations gave us the money. And still, there was a need. We had the restaurant and service workers reach out to us because they were in need of diapers because the businesses were closed down. So we tried to help them. We had refugees that reached out to us, and also we were trying to have them. But all of this with the pandemic helped raise awareness to the diaper crisis, because something that we've been trying to do for 8 years seemed like it just happened overnight, where foundations understand, where the community understand about the diaper need. And so that helped us develop relationships with new foundations. And so we still were getting those calls. So what we did was we partnered with the school districts. So when they gave out food for the kids coming for lunch, we also gave out diapers to the moms. We set up pop-up tours, what we call, and we would go out in the community and set up in different areas to give out diapers. And we also set up pop-up tours in other counties outside of the county that we're located in. And once we set up pop-up tours in the other counties, it was so successful that now we're trying to find permanent hubs in those counties so that we can network, so that we can get more diapers out into the community. And so another thing we did is we're doing drive-bys. And we partnered with the Pittsburgh Penguins. We partnered with the Pittsburgh Penguins Foundation to do a drive-by diaper distribution. And within 3 hours, we gave away 80,000 diapers. And that was to the people that drove through. We also had a lot of people walk up because they didn't have a car. And so we arranged for them to pick up their diapers not far from where we did the diaper distribution. And so people were walking up to pick up diapers and people were driving up to pick up diapers. And we just had to cut it off after 3 hours because that was our time frame, but people were still coming, and so people are still in need. So now we're in the process of our partnership with another nonprofit to do more drive-bys in this county, but also do drive-bys in a couple other counties, because the diaper need is there. Because now you have lots of jobs, lots of businesses, lots of commerce, and the need is still there. And so when you go to the suburbs, like I said, because of the loss of the jobs, but because of gentrification, which it was already there, it was hidden and no one knew it, but now it's even exposed because of the loss of jobs. And the people in the rural areas, they have many obstacles, but very few resources. And one of our board members is from a rural area, and he says they need diapers. They need diapers because they have no way of getting anywhere. And so we know like the 1 in 3 families, but with the COVID, that ratio, we don't know what it might be right now because so many people are in need. And if you have a diaper need, you have other needs. The diaper need is just the beginning of what that family needs. So you don't want to just take that diaper money and buy that food or pay that bill. You want to meet other needs. So what we're doing today is trying to address those needs. And we have distributed, in the first 6 months of 2020, we've distributed more diapers, more wipes, more period products than we did the entire year of last year in 2019. And as things open up, there still is a need. We opened up for a little while, but now COVID cases are increasing. And so now we've shut down some more. So we just have to figure out how we're going to reach these families, how we're going to get these diapers out to the families that need them on a consistent basis. It takes manpower and it takes funding to get the diapers out to the families. And it's impossible to do it without either one. But we know that the need is there. We know we're going to have to continue to help, and we can't do it by ourselves. It takes the community. It takes network. It's going to take collaboration, outreach, and everything to serve these families. Thank you.
Thank you, Cathy, for your eloquence and remarkable work during these times. And thank you, Megan, Zach, for your careful analysis, Representative Gomez for your leadership, and Curran First Focus for persistently drawing attention to the needs of children, how we can meet them over the years. I'm Indi Dutta-Gupta, and I'm co-executive director of the Georgetown Center on Poverty and Inequality. We're a nonpartisan policy research center at Georgetown University focused on expanding economic inclusion in the United States with a cross-cutting focus on racial and gender equity. I want to make 3 big points. One, that the COVID-19 crisis has increased hardship, particularly for Black and brown children living in households with low incomes. 2, that the CARES Act was a crucial down payment and additional assistance is needed. 3, that a number of specific recommendations would limit hardship among children and jumpstart the economy. So first, the COVID-19 crisis, as we've learned, has increased hardship, particularly for Black and brown children living in households with low income. So we know there's evidence that the CARES Act stabilized or even reduced income poverty rates on an annualized basis, but we also know there's still widespread and growing hardship compared to before for families both below and above the poverty line. And that's particularly true for Black and brown children across the country. Partly, as Zach mentioned, many supports in the CARES Act have been slow to reach those in need because of flaws in both the policies, some of which Megan described as well, and the administration of the policies, including the federal government's distribution systems for cash payments and deep shortcomings in the state administration of unemployment insurance. So, for example, we had, according to our friends at Columbia, an estimated 30 million income eligible people who were otherwise not eligible for the economic impact payments and or recovery rebates. And then we've also got about 12 million eligible people who don't need to file taxes, who may not receive their payments because they won't file for them. And that's a disproportionately Black and Latinx population. We've talked about the rates of food insecurity having doubled since the onset of the national emergency in mid-March, and even tripling for households with children. When you look at Black and Latinx households with children, you see higher rates of food insecurity than white households in April and May. And according to another survey, the University of Oregon's Rapid EC Project's weekly pandemic survey, households with young children saw an immediate decrease in well-being for both the children and the caregivers at the outset of the pandemic. And while well-being appeared to improve overall, maybe in response to some of the policy measures that Congress has undertaken, some subgroups did not see improvement. In particular, among lower income households, caregivers appear to be experiencing more depression and anxiety. In households with 3 or more kids, caregivers are experiencing more depression and stress. And while in the early weeks of the survey, anxiety and stress were decreasing for African American caregivers comparably to the overall sample, in recent weeks, these trends have reversed, where specifically African American caregivers are seeing increasing depression and stress. As Cara documented herself earlier, households with children unquestionably continue to be hit harder by the financial pressures caused by the pandemic, and are facing higher housing and food affordability challenges than households with children as well. So the second point, the CARES Act was a crucial down payment and additional assistance is needed. So look, the early federal response, including the Families First, coronavirus response, and CARES Act, definitely provided an essential down payment. We've got additional evidence, Zach mentioned, from the Urban Institute, suggesting that about 10 million plus people may be kept out of poverty this year by the CARES Act. But also, as has been mentioned, it's simply not going to be enough. A lot of the heavy lifting is being done by the $600 weekly pandemic unemployment compensation, and of course, the one-time cash payments. The $600 ends on July 26th as of now, and the one-time cash payments are, of course, mostly out the door, and even if they're not, they probably cause hardship by being slow to reach people. Now, I worked in Congress on these sorts of measures before, during, and after the 2008 financial crisis. And if there's one thing we might learn from that experience, it's this. Policymakers must avoid ending anti-recessionary spending prematurely. Following the enactment of the American Recovery and Reinvestment Act of 2009, increased federal spending rapidly turned into deficit reduction or austerity. The economy, as a result, needed 89 months to close the jobs gap following that crisis. In other words, it took nearly 7.5 years to create enough jobs to recover from the jobs lost and absorb new workers during and following the last recession. Today, policymakers have a chance to avoid repeating the same mistake and avoid the same prolonged crisis of unemployment and human suffering. So the third point. A number of specific recommendations would limit hardship among children and jumpstart the economy. So first, we've all discussed the HEROES Act, for example, has additional and more inclusive recovery rebates. There's lots of evidence that workers and families need this, partly the lack of predictability and reliability of one-time rebates, though they nevertheless were important and a lot of them were quickly spent by families with the greatest need. But the lack of predictability and reliability might keep families from even spending if that's all they have as a cushion going forward. And Megan outlined, I think, quite well who's left out. But we should also think about with the next round or additional rounds, especially if they're tied to economic conditions, we should have multiple additional rounds of cash transfers. We should think hard about how we can have more automatic payments that the Treasury Department can enable and really empower more households without bank accounts, especially to use fee-free debit cards, which is certainly part of the implementation, but could be expanded. And we also have existing measures like the working family tax credits, the earned income tax credit, the job tax credit that are helpful not only directly for households, but for the broader economy and could be made far more accessible with a more aggressive or no phase-in for families with modest earnings and reach more adult workers without qualified children with a larger credit, as well as more households in Puerto Rico. Now, thinking a little also about what Megan told us about when families need additional support, one of the things that we absolutely have to do is address caregiving needs. And that can be through a number of measures, such as more direct spending through the Child Care and Development Block Grant and complementary programs, as well as an improved child dependent care tax credit. The childcare sector is meaningfully on the verge of a collapse without a massive infusion of no less than $50 billion really right now. What that means is that childcare providers are going to have to close up shop permanently because they can't sustain the current situation. And in some cases may not be able to afford reopening with the needed public health measures and additional costs of doing so. At least not reopening with the same capacity as they had before. So there are a number of measures, as we described, that could help here, but it has to be a top priority. I'll just add that there are other essential ideas that would help children, including expansion of SNAP and housing assistance. We're seeing a serious foreclosure and eviction crisis unfolding. And it's only going to amplify if we don't immediately extend the $600 weekly pandemic unemployment compensation, among other things. And we should also think about beyond continuing unemployment benefits, a new job seekers allowance for those left out of the UI system. And that includes the young adults that Representative Gomez discussed earlier. And also, part of caregiving is the need for permanent and robust paid leave. Congress obviously acted for the first time with the national paid leave mandate, but nobody who works on this issue thinks that it has been as successful as a permanent and more extensive program could be. And we'll, of course, need state and local fiscal relief, since a lot of our job losses already and going forward are going to be concentrated in those sectors. So let me just close by saying we are still facing an emergency, and we're still facing a crisis, but the effects are going to be long lasting. And as a nation, we've been knowingly manufacturing and tolerating child poverty and hardships for generations. So the pandemic, for all its novelty, though, has been predictably amplifying virtually every existing inequity we had, especially racial inequities. And so that makes this moment an opportunity. And I think we owe it to all those who have fallen ill and even lost their lives at the hands of our inequitable and racist systems during this pandemic and otherwise to act. And we need substantial, sustained, and ultimately structural change. Out of the depths of this pandemic and recession, we have a chance to build an economic security and opportunity system worthy of the richest country in the history of the world, worthy of our families and caregivers, and worthy of our children, Black, brown, and of every other race and ethnicity. Thank you, and I'll turn it over to Megan, who I think will facilitate questions.
Thanks so much, Indi, and thanks to Megan and Zach and Cathy for all of your work on the ground. Before we get to questions, I just want to mention there are 2 handouts posted at the bottom of your toolbar. The first is recommendations for First Focus Campaign for Children, many of which align with what Indi just discussed about what we know is still needed to either extend provisions in the CARES Act or go further than the CARES Act. And the second resource posted there is the new resource from Columbia that Megan and Zach discussed about the impact of the CARES Act on poverty, including child poverty. Both of those resources will also be sent out with the recording to anyone who RSVP'd, so you should be receiving that in the next few days. So we have a few questions here that have popped up. You can also please continue to submit questions as we have a few minutes. If we don't get to all of the questions, we didn't get to your question, or you think of one later, you can feel free to email me afterwards, and I can direct question to one of the panelists. I'm going to put my email in the chat, but it is Cara, C as in cat, A-R-A, B as in boy, @firstfocus.org, and I'll put that in the chat as well. So Cathy, one question we got that is directed towards you is, what initiatives exist or are being developed to, try to advocate to Congress about the need for increased support to address diaper need and to support diaper banks during COVID. So I was wondering if you could talk at all about maybe some of the work that the National Diaper Bank Network is doing, or just what you would think would be helpful to address the need that you're continuing to see on the ground in your community.
So on the ground in my community, we are trying to work with the politicians to raise awareness to the diaper need. I think through our drive-by with the Pittsburgh Penguins and the foundation, we had politicians out there so that they can see the families that need the diapers. On a national level, they lobby once a year to the congressmen, senators about the diaper need. I'm not sure what the bill is now, but there's a bill out regarding funding for diapers for the families, so that they can purchase the diapers with funding to help out. So we are trying to address the need on that side.
Great. Great, thank you. And I know, you know, we always appreciate the work of the National Diaper Bank Network. And so any materials that you guys have, you can make sure to send, and we can send out to audience members as well. One question we got is from a fellow advocate in West Virginia, and something they're encountering is that the $600 a week that families are receiving in unemployment are knocking people off of SNAP due to income guidelines. There were protections put in place for Medicaid, but that it might be affecting people's SNAP benefits. So I don't know if anyone can talk to that about any efforts that might be happening. Indi, if you want to address that, Megan and Zach can also feel free to jump in.
Yeah, that's definitely a concern. I think that it's something that policymakers in Congress were aware of, and those fighting for the provision to at least protect people's health coverage and maintain continuity of health coverage have indicated that there was opposition to expanding those sort of disregards for eligibility based on the negotiations, but they're expanded somewhat, as I recall, and I can find out more in Heroes. And you're right. I mean, this is a sort of challenging and sort of labyrinthian and complex set of programs and rules that folks have to navigate. You know, to be clear, in many cases, if not virtually every case, if you can relatively easily get back on, say, SNAP or some other program where you lose benefits, that $600 and the UI or pandemic unemployment assistance benefits will be worth it.
Thanks, Indi. And I know that that's something here at First Focus. I know we've advocated for, and I know there's efforts from many others to advocate for those disregards as well, those additional disregards. This is a question for Megan and Zach, but Indi also, you've done a lot of work on this. You know, a lot of what we've highlighted here is that, you know, we know that the pandemic has served to exacerbate and expose our high level of child poverty, you know, that already existed. And so a lot of what we need is continue to mitigate the problem. But we also, as Indi talked about, we have an opportunity to put in structural changes that could really affect our child poverty rate moving forward and really lower our consistently high level of child poverty. And one thing that I know many of you have worked on is the idea of a more aggressive child tax credit and strengthening that and converting it to essentially a child allowance, which many of our peer nations have and have lower child poverty rates as a result. And so I'd love Megan or Zach, if you want to talk a little bit more about why you think that would be helpful as part of addressing the needs that we're seeing in the pandemic, as well as for longer term change. And Indi, you could feel free to jump in as well.
Sure, this is Megan. We know that, you know, first of all, we know that cash matters to kids. There's a ton of research that shows, you know, the positive impacts on development when families don't have financial strain in the household. We know the research that shows the, you know, the meaning that an extra, you know, $1,000 has on, you know, reading results and math scores and things like that. And on the flip side, unfortunately, from just a few years ago with the last recession, we know the impact that, you know, the lack of resources in a household, especially when it comes on very sharply and suddenly, that even if kids, you know, sort of drop into poverty for a short amount of time, it has lasting results on them. And so, you know, even though the cash supports that, you know, we looked at in our most recent analysis were can were critical to try and plug some of the immediate gaps that families were seeing. We also saw a disparity in the payment levels. So it was $1,200 max cash payment for adults, but it was $500 max per child in the family. And again, that's for those who were able to receive it. If they're in non-filer families, dependents in those families, so the kids in those families essentially are at much higher risk of not receiving those payments. What we have seen is that, pushes in the most recent HEROES Act, and hopefully might come up again in the discussions around a future package, is that we have some tools that can very easily, sort of step in and help supplement these things, the child tax credit being one of them. And the child tax credit does quite a lot of good work, again, in reducing annual poverty, but when it comes as a lump sum payment once a year, there's a limit to what families are able to use it on. They can't count on it as part of their household budget. That's even more of an issue right now. And so if there, regardless of whether or not there end up being additional cash payments, especially if there are still lower payment levels for children, there are existing proposals out there. We've seen it, with the American Family Act and what's been passed most recently in the HEROES Act, that you can transform something like the child tax credit into from an annual payment into something that's paid out regularly at a higher rate. So it's more meaningful for families and actually can be counted on as part of their monthly budgets and as a real resource that they can use towards, supplementing kids' foods, supplementing their educational needs. If it needs to go towards housing, making sure that a kid, has their own bedroom, so that there's housing, security, and stability. All of these things, it gives a flexibility for use here. But I think the last piece that I'll just end on is the really important piece, is that the child tax credit, we see that it's been addressed in the version that was passed in the HEROES Act, but it needs to be able to be accessed by all kids, especially those who are currently left out under the current version. We're seeing 1/3 of all children who should be receiving the child tax credit are in households where earnings are not high enough to receive it. And so we can fix that by removing those requirements, making sure all kids receive it, and making it a regular payment.
I'll just add one small point to that. I mean, over the last 20 years, we've seen a decline in cash assistance from the Temporary Assistance for Needy Families program, often referred to as welfare. And so at this point in the US, even before the crisis, if you are let's say single parent, you lose your job, what's waiting there for you? Depending on the state you live in, you might get cash assistance from TANF, but more than likely it's going to be SNAP benefits, and that's about it. If you take that same single parent family and move them to, say, Canada or the United Kingdom, it's a much different experience in that scenario where they lose their job. There's a child allowance waiting. There's a different system of unemployment insurance that will make sure that they don't fall through the cracks. We have some large structural problems that should have been addressed a long time ago prior to the crisis that we have an opportunity to address now, to make sure that even when we recover from this, if you are a parent and you lose your job, it doesn't mean that the only thing you have to access is food stamps. And that's the only part I have to add. So thanks.
Thanks so much, Zach and Megan. And we're going to do one last question because we're running out of time. Indi, I'm going to direct this at you. I know you've done so much work around the poverty measure and how to accurately really capture poverty in this country. And so could you talk a little bit more about, what are some ways that ideally we could change the poverty measure to really truly reflect material hardship in this country, right? We just heard about diaper need, and we know that so many families, right, at or near the poverty line or even above the poverty line still struggle with material hardship. So if you could just talk a little bit more about ways that we could improve our measure moving forward.
That's a great question, Cara. I mean, fundamentally, a poverty measure should reflect the prevailing living standards in the society. So I think we need to think much more comprehensively about people's needs. We need to engage people with current and recent lived experience with poverty, low income, hardships, deprivation in that process. And we need to think about how to build some sort of common framework and understanding with experts who will have to really use, champion, and ensure that a new measure is sort of consistently developed and put out. I think there are proposals. I think Representative Ocasio-Cortez has a proposal to advance this sort of approach. And, you know, to be clear, as Megan mentioned, other rich countries have lots of options, including market baskets of goods, including percentages of median income, including multidimensional measures that account for hardship incidents as well as income. And we have a lot to draw from. But we sort of have the worst of all worlds here with the official poverty measure. But the supplemental poverty measure is certainly a useful step and helps us develop something closer to a disposable personal income measure, which we don't have in other contexts. And, you know, with the United States having just extraordinarily expensive healthcare, I think that we need to also think hard about how to account for that and those challenges that people face, which is combined with the fact that many people in this country, again, unlike the vast majority of other rich countries, lack access to healthcare and health coverage. So there are promising approaches, and fundamentally, I'd say let's make sure that a new measure is tied to prevailing living standards and consistent with how the public might conceptualize and perceive of the concept.
Great, thank you. That's really helpful. Well, we are out of time. Thank you so much again to our panelists for joining. Thank you to Congressman Gomez for his leadership and his powerful remarks. We again will be following up with a recording of this and our handouts. And then my email is in the chat if you have any additional questions that we didn't get to for our panelists. So thank you again for tuning in and hope everyone has a great rest of their day.